Um, I got proper PPE on. Is the scene safe?
Yes.
Okay, the scene is safe. Mechanism of injury for the patient?
Motorcycle crash.
Motorcycle crash. Okay, so I'm taking care of proper precautions, making sure the scene is safe. Just this one patient that I'm dealing with right now?
Correct.
Okay. I'm gonna request ALS backup here, and for this patient, I am not going to consider, or I'm going to consider that the spine is not stabilized. So we'll make sure that we have spinal stabilization, and we apply a collar for the patient. I'm gonna go into my general impression for the patient. Patient seems to be unconscious, not too sure yet. Doesn't look too well. I don't see any bleeding right now. But I'm going to do a primary assessment, secondary assessment to assess that. I'm going to check for the patient's consciousness or level of consciousness for this case. And then, yeah. So, hey, are you okay, buddy? Patient is unconscious. So, mechanism of injury is a fatal crash, motorcycle crash. So I'm going to assess his airway. Is he breathing? Is he breathing or no?
No.
He's not breathing?
Yes,
Okay.
he is.
Oh, he is breathing? Okay, perfect. How's the rate, rhythm, and quality for that? So
Fast.
Fast and shallow, it seems?
Yes.
So he's hyperventilating here. Okay, so this does seem like it's going to be a rapid transport, so it seems most likely it's going to be some diesel therapy here for this patient. Okay, because he could have some sort of brain injury or going through some sort of shock. We'll assess that as we go along. So hey, his spine is stabilized. I have my partner right here. I'm gonna check his breathing. I'm gonna check his lungs to see how it is. And how's that? How's the rate, rhythm, quality for those?
Shallow.
Shallow too? Okay. And as for circulation, I'm gonna see how's the pulse, how's the rate, rhythm, quality for that?
Slow and shallow.
Slow and shallow. Don't you mean rapid?
Rapid and shallow.
Yeah. And okay, since he's unconscious, I'm gonna check the carotid here.
Rapid and shallow.
Rapid and shallow. Okay, and how's the skin feel to me?
Cool.
Cool?
Clammy.
Cool and clammy?
Cool.
Is he sweating too?
Clammy is sweating, yes.
Okay. Okay, so that's not too good for right now. From my signs, it seems that he's possibly going into shock. So definitely going to transport him. We'll have time to wait for ALS, but for the purpose of the assignment, I'm gonna go through the secondary assessment here. So I'm gonna be feeling. Do I feel any tenderness, wounds, deformity here?
No.
How about on the back?
No.
Is there any cerebrospinal fluid coming out the ears?
No.
Okay, I'm checking the eyes. How are the eyes?
All good.
All good? They're not unequal because of a head injury or anything like that?
Nope.
No? Okay. Okay, I'm opening the mouth here. How's the mouth look?
Good.
Good? Okay, so everything's fine from right there. I'm going to go into the neck. I'm checking the trachea. Is it in place?
Yes.
Is there anything I should be worried for? Okay. I'm checking the spines to see if anything else is back there. How's that?
Good.
Fine? Okay. I'm working now next to the chest area, checking anything. So wounds, tenderness, deformities here. So I'm seeing how that feels. Everything feeling good for me here?
Yes.
Okay. I'm going to be checking the next. Oh, and before I forget, I'm also going to be assessing the lungs too here for quality. So you said they were shallow, right?
Shallow.
All right. Then. Now I'm checking the abdominal area, wounds, tenderness, deformities. Dr. Germ. Shoot. I'm trying to remember. Sorry. Superintendent deformities, I guess, right now. How does that feel? Is there anything I should be aware of?
The lower abdomen feels hard and warm.
Lower abdomen feels hard and warm. It's almost like is it warm? Is it bulging?
Yes.
It's bulging? Okay, so there's possibly some internal bleeding that's occurring right there. So like I said, this patient we have the spine stabilized and we should be heading out right now. How about the pelvic girdle? How's that feel? Is there anything?
Crepitus.
Crepitus. So I hear some crepitus here on the bones. So definitely want to get that together, pelvic girdle, to keep it all together. Genitals, fine.
Abnormally small.
Normally small. Well, unfortunately, that's out of my scope of practice here. So, how's the leg feeling? Any fractures I should be aware of?
No.
No. Okay. How about the pulse for the leg?
Very light pulse.
Very light pulse. Okay. Same thing for this one right here. Anything I should be worried of?
No.
Same thing with this pulse too, I'm assuming.
Very light.
Now I'm going to check in the arms for this gentleman. No fractures I should be aware of here too?
No.
Okay. Pulse here too?
Very light.
Very light, okay. So normally the person who's doing C-spine is going to be controlling the log roll, but given the situation, I'm just going to be doing it right here. We're acting like he's calling, so 1, 2, 3. Checking the spine, making sure there's nothing out of order here. How's that feel? Anything
All good.
Good, okay. Checking his butt. Is that okay?
Yep.
Spreading the cheeks, is that fine?
Yep.
Okay, so for this patient, obviously they're from, at least what it seems, that they're going through some sort of shock. So this is a major transport priority right here. So we'll make sure we put a blanket on them to keep them hot, and just try to get them to the next trauma center taken care of.